Welcome to The Explainer. We're jumping right in today because we're tackling what is, without a doubt, one of the absolutely most terrifying things a parent or caregiver can ever witness: a child having a seizure during a fever. Look, it's a moment that can send you into an absolute panic. It feels incredibly isolating. But today, we're going to pivot straight from that totally understandable fear right into the reassuring, evidence-based medical science. We're going to break down exactly what's happening in the body and, more importantly, exactly how you can handle it with total confidence. So here's our agenda for today. We'll cover 1. What are febrile seizures? 2. Causes and brain mechanisms. 3. Recognizing types and symptoms. 4. Emergency first aid steps. And finally, 5. Clinical guidelines and prognosis. Okay, let's get into Section 1. What are febrile seizures? Defining the event. We've got to tackle this scary question right off the bat because it's a massive source of anxiety for so many parents. When your kid has a spiking fever, your mind just naturally races to the worst-case scenarios, right? Well, the answer to this question, surprisingly, is yes. A run-of-the-mill fever really can be the sole trigger for a full-blown seizure in a young child. But to really grasp why this happens, we need to look at exactly how the medical world defines this event. All right, so here's the precise clinical definition. A febrile seizure is a convulsion triggered by a fever in young children. Specifically, and this is key, within a very distinct developmental window between 6 months and 5 years of age. Now, the absolutely most critical part of this definition is the second half. These seizures happen without any evidence of a central nervous system infection, so no meningitis, no encephalitis. And they happen without any prior history of afebrile seizures, seizures that just happen without a fever. This distinction is huge. Why? Because it completely separates a temporary fever-induced event from a chronic underlying neurological disorder. And get this, up to 5% of children will actually experience a febrile seizure in many populations. That's a lot of kids. It literally makes it the single most common seizure disorder of childhood. So if you're a parent who's been through this nightmare, or a healthcare worker comforting panicked families, this number should be incredibly reassuring. It's a solid reminder that you're definitely not alone, and pediatricians see this kind of thing all the time. Moving on to Section 2, Causes and Brain Mechanisms, the Science of Fever. So what's actually causing the fever in the first place? Well, honestly, it's usually just the everyday bugs kids catch all the time. Common viral triggers, we're talking influenza, rosola, adenovirus, COVID-19, your basic ear infections, or even a bout of gastroenteritis. These are usually the culprits. When a child catches one of these, their immune system fights back by releasing pyrogens. Basically, these are fever-inducing chemicals. They travel up to the brain and tweak the hypothalamus, which acts as the body's internal thermostat. It literally cranks the thermostat up to help fight off the infection. But here is the absolutely crucial point. It's not actually about how high the absolute peak of the fever gets. It's the rapid rise in body temperature that triggers neuronal excitability. See, a developing pediatric brain, with all its rapidly forming synapses and networks, is incredibly sensitive to sudden changes in its environment. When the temperature spikes super fast, it essentially just overwhelms the young brain's electrical regulation for a minute, and that results in a physical seizure. All right, Section 3, Recognizing Types and Symptoms. Simple versus complex. So doctors basically categorize febrile seizures into 2 camps, simple and complex. A simple febrile seizure is by far the most common. It lasts for less than 15 minutes, it only happens once in a 24-hour period, and it's what we call a generalized seizure. That means there are no focal neurological deficits. The whole body's involved, not just one side. Now, on the flip side, we have complex febrile seizures. This is when it lasts 15 minutes or longer, or maybe it happens multiple times within a 24-hour window, or it has a focal onset where the shaking starts on just one side of the body. These complex seizures carry a slightly higher risk, so they definitely require closer medical monitoring just to make absolutely sure everything's okay. Now, when a child arrives at the ER, doctors immediately run a differential diagnosis. They need to be 100% sure they're dealing with a febrile seizure and not something far more dangerous, like bacterial meningitis. While the febrile seizure is triggered by that rapid fever spike we talked about, meningitis is a severe central nervous system infection. Doctors are going to specifically check for things like neck stiffness and extreme lethargy, which you just don't typically see with a standard febrile seizure. If they do suspect meningitis based on the physical exam, that's when a lumbar puncture and urgent antibiotics become absolutely necessary. Going back to the actual event itself, we really need to validate the caregiver's experience here. These symptoms are truly terrifying. During a febrile seizure, a child will typically have a sudden loss of consciousness. You're going to see whole body shaking, rhythmic jerking, eye rolling, and stiffening of the limbs. And really alarmingly, you might even notice temporary breathing irregularities or brief cyanosis. That's a bluish tint around the lips or face because of a temporary drop in oxygen. Honestly, it's awful to watch. But it's incredibly important to know that immediately following this, the child will usually enter a post-ictal state. This just means they'll be incredibly sleepy, exhausted, and confused before eventually returning to their totally normal everyday baseline. Which brings us to Section 4, Emergency First Aid Steps. What now? Okay, I want you to walk through these exact steps mentally with me right now, so they become second nature if you ever actually need them. Step 1, stay calm. Your clear head is literally your child's best asset right now. Step 2, gently place the child on their side in the recovery position. This keeps their airway totally clear. Step 3, clear the area of any hard or sharp objects. Step 4, and this is a big one, do not put anything into the child's mouth. And whatever you do, don't try to physically hold them down or restrain the shaking. Lastly, Step 5, look at the clock and time the duration of the seizure. Remember, you might naturally want to give them ibuprofen to stop the fever, but fever-reducing meds just won't reliably stop an active seizure. Your only job right now is to keep them safe while it runs its course. And timing the seizure brings us to this really critical threshold. You absolutely must call emergency medical services if the seizure lasts for more than 5 minutes, or if their breathing doesn't return to normal right afterward. A seizure that crosses that 5-minute mark approaches what doctors call febrile status epilepticus. At that point, it's no longer just a standard self-resolving event. It becomes a true medical emergency that requires professional medical interventions, like paramedics or doctors administering specific medications to actively stop the convulsions. Finally, Section 5, Clinical Guidelines and Prognosis, the long-term outlook. Okay, so this is arguably the most reassuring part of the whole explainer. When we look at major international health bodies like the World Health Organization and the American Academy of Pediatrics, their evidence-based guidelines are incredibly unified. Their #1 recommendation to doctors: reassure the families. Next, they say the clinical focus should just be on finding the source of the fever, like figuring out if it's an ear infection or the flu. Crucially, they actually advise avoiding routine EEGs or invasive neuroimaging like CT scans or MRIs after a simple febrile seizure. On top of that, putting a child on daily routine anti-seizure medication to prevent future episodes, also not recommended. Those intense interventions just aren't necessary for simple cases. So the big question, after a first febrile seizure, is it going to happen again? Well, about 35% of children will have a recurrence the next time they get a rapid fever. But take a look at the much larger slice of the pie here. 65%, the vast majority, will never have another one. And here's the absolute best part. Regardless of which group a child falls into, medical science overwhelmingly shows that normal intelligence, normal school performance, and completely normal brain development are expected. Simple febrile seizures simply do not cause brain damage. We're wrapping up today with this incredibly powerful consensus from the pediatric medical community. Yes, these events are incredibly alarming, but they are usually harmless and resolve without any long-term effects. So I'll leave you with this final thought. If knowledge is the ultimate cure for panic, how will you use this evidence-based protocol to protect the children in your life and empower the caregivers in your community to face a genuinely terrifying moment with absolute confidence?